There's a mystery virus going around and cases are rising with our children at most risk. Now, some of you guys might say, well, we know, Ron, it's happening in China, right? Well, yes, but now we're seeing an uptick of illnesses right here at home in the US. Also, stick around to the end because I may have figured out just why this is happening.
Respiratory illnesses are wreaking havoc at hospitals in China and raising concerns for the medical community across the country. Here at home, it's no exception. Fox 5 has learned hospitals, emergency rooms, urgent care locations, and clinics are really seeing an uptick in sick visits. Fox 5's Tisha Lewis joining us tonight live from Dumfries with more. Hey, Tisha.
Hi there, Angie. So the World Health Organization is apparently reviewing some data from China after concerning video emerged showing droves of people lining up to be treated for what's being described as a mystery respiratory illness disproportionately impacting children here at home. We're told sick visits at clinics in the area, like the one behind me, also up. Even so, we spoke with the medical community. They insist there are no new pathogens found.
What we know so far is that the World Health Organization has asked China to share some data about an increase in respiratory illnesses, especially affecting children, specifically in northern China. What we know so far is that these are not novel, so not new viruses. These are all things that we have seen before in seasons past.
Just a little bit sketchy on that last part, because if they're diseases that we've seen before in the past, why is the World Health Organization asking for more data? Also, and here's something that I just kind of noticed. We're inching closer and closer towards the 2024 elections. And like, what happens if we have lockdowns? Are we going to see more mail-in ballots this time around? I mean, I'm just asking logical questions here, right? So here's the thing. If they do want to impose lockdowns yet again, will you say yes to it? Comment a quick yes down below. And while you guys are at it, go ahead and hit the like button for the video. I really appreciate that. Now, you might be saying, why are you talking about elections, Ron? Well, it's hard not to connect the dots here since this mystery respiratory disease seems to be impacting Washington, D.C. as we speak. So here's the trillion-dollar question, though. Are we going to go through the same thing again as we did just a few years ago? Now, I'm not trying to predict anything like that again for us, but this is eerily similar to what happened back then, right? A mystery virus like supposedly leaking out of China and then putting the entire globe in a chokehold for like 2.5 years and then some. And the worst part is, well, the World Health Organization is again getting involved, which means that there's a chance that we may actually see mandates, much like we saw during the last pandemic.
Pediatric departments across China are struggling to cope. There has been a surge in acute respiratory illnesses among children over the last several weeks. Hospital waiting rooms are packed with parents and their sick children waiting for medical care. Should we also be worried?
监测显示，近期呼吸道感染性疾病以流感为主，此外还有鼻病毒、肺炎支原体、呼吸道合胞病毒、腺病毒等引起。分析认为，近期我国急性呼吸道疾病持续上升，与多种呼吸道病原体叠加有关。
The surge in cases prompted the World Health Organization to ask Chinese health authorities to provide more information about the spike in respiratory diseases among children in its northern regions. In a teleconference with the WHO on November 23rd, Chinese officials said no new or unusual pathogens have been detected in the last few months. They said cases of children with Mycoplasma pneumoniae started to rise as early as May, and respiratory diseases caused by other pathogens began to jump in October. As the spread of such illnesses are common with the onset of winter, authorities are urging people to minimize personnel movements and visits. But hospitals are overwhelmed with people who are already sick. The Tianjin Children's Hospital has been dealing with a record 13,000 pediatric cases a day, and the Civil Aviation General Hospital in Beijing said its pediatric outpatient clinic was handling as many as 650 visits, up 50% from this time last year. In addition to limiting movements, officials are also urging people to get vaccinated.
But now, oh boy, now they're going to say that to avoid having history repeat itself, there are going to be some tougher lockdowns, mandated masks, heck, maybe even double masking too, social distancing, where you can't see your loved ones or even your friends, businesses and schools to be closed, mandated jabs or you lose your jobs, and again, just like I said, mail-in voting. Although that's just a hunch, okay? All I'm going off of here is what we experienced before. and just how they can pretty much up the ante even further, all right? And I'm not saying that they're going to do it. I'm also not trying to scare anyone here. I'm just here to inform you guys about these upticks in cases and what could possibly happen if a lot of things go horribly wrong. You see, they've been talking about this thing for months now. And, you know, if you follow the channel, you'll see that I've been following this narrative that they've been trying to tell us for a while. I mean, they even called one of them Disease X to make it sound that much scarier. And no, it's not here in our country, at least not yet.
The British government has unveiled a new vaccine research facility where scientists are working to prevent future pandemics. It's located at Porton Down, a high-security research facility best known for its work on chemical warfare. Experts are preparing for what is known as Disease X, or the next pandemic virus.
Disease X is a legitimate health scare, the next unknown disease of epidemic potential. This term was formalized by the WHO in 2018. It was named X because of the lack of knowledge about it. It's not known what this disease will be, whether it will jump from animals to humans, or whether it will be a mysterious lab creation. But one thing scientists are certain about is this: Disease X is coming. They don't know when, they don't know how. What they do know is that it could be far worse than the Wuhan virus.
Well, could the next pandemic make the height of the COVID-19 outbreak look mild? That's what some experts are predicting for what's being called Disease X.
So here's what I want you guys to notice. And I know that a lot of you have already caught on, but this is somehow subliminal messaging. In this case, it's kind of like something that you only see in theaters or on your TV. You see, there's a little something called foreshadowing in movies. It's when a scenario or an event is predicted at the beginning of the story. In some way, it's to prepare our minds for what's about to happen. With all these reports coming in months ago about a supposed virus that's worse than the one that we've already experienced, is it safe to say that we're going to be in for the long haul come 2024? And the WHO, the WHO, they're really getting involved here yet again. And it could be because their initial plan to take over and have complete control over the population isn't quite panning out as well as they thought it would. They got a few months before they try and push the pandemic treaty, or accord as they've renamed it, an accord that will eventually put them in charge over the masses if and when another pandemic happens. The words and messaging may not match perfectly with this, but it's pretty freaking close to it. Now, I don't want to alarm you with this one. That's not the point of any of this. I'm just here to give you guys information and make you aware of what's happening, all right? And what's happening is that a clinical pathologist recently said that the DNA contamination in some C19 vaccines may be related to... Are you guys sitting down for this? You might want to sit down because this one's a doozy. So the pathologist says that some C19 vaccines may be related to an increase in cancers, microclotting, and autoimmune diseases. I told y'all you should be seated when I said this. And they're not just saying this out of spite. The numbers are backing these statements up as well. I'm expecting jabs will also be mandated if we ever face another global pandemic. But I get it though. We all have different perspectives when it comes to medicine. I respect that 100%. And what you do with your body is your business. The only issue here is that the findings aren't looking so great, with cancers rising in 44 countries, primarily for young adults. But again, do with that information what you will. Now, my last question for you guys in this video, and I really want you guys to be thinking about this. Do you consent to give your rights to unelected leaders? Make sure you guys answer down below in the comments. And before I go, I just want to thank you guys so much for hanging out. I appreciate all of my supporters, all of my subscribers. Keep safe, and I'll see you guys on the next one.